Greetings, everyone. My name is Cole Racich. I'm a licensed physical therapist and board-certified orthopedic specialist at Advanced Physical and Aquatic Therapy. So I wanted to hop on with a virtual journal club here and share some recent research we were looking at that speaks particularly to our diabetic population. So we certainly, where we practice between Springfield and Broomall, have a large percentage of our patients and clients that have diabetes in their past medical history in some form. And oftentimes it's very well managed and very well controlled. One of the things that we've long known and long seen is the correlation between diabetic past medical history and the onset or prevalence of musculoskeletal pain, whether that's in the form of adhesive capsulitis in the shoulder or tendinopathies, particularly with the Achilles. We know that there's a strong link per the research between diabetes and musculoskeletal pain in general. And one of the things that we always try to educate our patients on is that if they do have diabetes, that when they develop low back pain or knee pain, not to necessarily always rush out right away and think they might need a joint replacement or an invasive surgery, that a lot of times their musculoskeletal pain can be correlated to their diabetic comorbidity, and that it usually needs a little bit closer management or some specific exercises to address those symptoms. One of the articles we were just looking at that came out in June kind of assessed different exercise protocols and tried to look at which one was the most effective at helping individuals with diabetes and musculoskeletal pain. And what they found was that 8 weeks of high intensity aerobic and resistance training was the superior intervention when compared to lower intensities. So kind of that was an awesome home run article for us to say that not only can we help our individuals with diabetes and musculoskeletal pain, but we know what kind of intensity exercise we need to provide for them. Now, I know what you're probably thinking, the same thing I thought of, is that I am picturing in my head all the patients I work with that have diabetes and come in with low back pain. And the last thing they want to hear is, okay, great, now we're gonna do some high intensity aerobic and strength training. A lot of these individuals likely weren't participating in a very intense exercise program previously and can be very intimidated and fearful from a high intensity program. So number one, the one thing that we always look at is just as physical therapists, the world we live in is teaching individuals how to gradually expose them to different activities and how we can dose that appropriately. But more specifically, where we like to send those patients is to our aquatic therapy environment. We find that an aquatic PT exercise program for our individuals with diabetes can be very, very effective at maintaining those higher intensities that we need to per the literature, while also mitigating any kind of soreness, increased pain, and really the fear that comes with someone starting an exercise program that they haven't done in a while. So again, kind of one of the take home here with this research is that number one, there's a strong link between diabetes and musculoskeletal pain. And number two, those individuals with diabetes and musculoskeletal pain benefit greatly from a high intensity aerobic and resistance program, and preferably in an aquatic center. I think that's probably kind of the home run that I looked at for this research. Hopefully this is helpful. If you have any individuals that you're working with that do have diabetes and develop back pain or knee pain, certainly we hope that you think of physical therapy and aquatic PT and specifically to get those individuals exercising at a high intensity so that we can decrease that pain and keep them out of the hospital system and help them get back to doing what they love to do. So hopefully this research was helpful, a little virtual journal club here. Hope you and your families and your patients are all doing well and staying healthy and well during these times, both physically and emotionally. Look forward to continuing to serve this community with you guys, and until next time, take care.